thank you for visiting with us today. If you could introduce yourself to everybody.
Okay. I'm Dr. Mindy Luck, and I work at Omega OBGYN. I've been there almost 13 years now.
Okay.
We have offices in Arlington and Grand Prairie and Mansfield, but mostly I'm in Mansfield.
Okay.
I live in Mansfield. My kids go to Mansfield schools, so we're very embedded in the community and love it here. So.
Okay. Today our topic is colon cancer, and there's a reason why we're talking to you, because you have a personal story with it. But are there some things that you can give us as far as pointers before telling a little bit of your story?
I sure can. I think the biggest thing that people forget is that colon cancer is one of the most preventable diseases that is up in the high ranks of cancer. It's second most common cause of cancer death in the United States, and
Wow.
third most common cancer diagnosis. So with those two factors and the fact that we have good screening, it's really a shame that as many people are diagnosed as they are. So I think they estimate in the next, in 2016, 135,000 people will be diagnosed with colon
Wow.
cancer, and 50,000 of those people will die from it. So
Because it was too late in the diagnosis.
mm-hmm.
What are some of the common symptoms, or are there?
There are.
Uh-huh.
Although I think some people feel like, oh, well, I'll just wait until I have symptoms. But really, a lot of times that's later in the disease. So the best thing to do is get your screening, which is recommended for anybody over 50.
Mm-hmm.
But symptoms can be as simple as going to the doctor and having some anemia on your blood work.
Mm-hmm.
And that should always be followed up. Rectal bleeding or bleeding when you have a bowel movement.
Mm-hmm.
But it can also be just some new changes in your bowel movements, like
Mhm.
constipation or diarrhea, abdominal pain or discomfort. So some vague symptoms that a lot of us have all the time. But I think the important thing is if they're there and they're not going away, you see the doctor, they're still not, you try the things they tell you and they're not getting better. Even if you're young, go in and get checked out and make sure.
So tell me what happened with you.
Now, I'm sure people wonder, why are you talking to a gynecologist about colon cancer? And that's because I'm a colon cancer survivor.
Mm-hmm.
I was diagnosed at age 40, so much below the screening cutoff, and I don't have any family history.
Wow.
So it was pretty random. I did have symptoms, and for a lot of my female patients, it's common symptoms. You have kids, and you have hemorrhoids, and you have bleeding. But you chalk it up to the hemorrhoids, and I have patients tell me that all the time. Well, I'm just constipated, or I have a hemorrhoid from when I had a baby. It's nothing.
Right.
Well, it might be something. And so, if anything like that is repetitive and persistent, you definitely want to get it checked out. So I kind of came to the realization that it had been going on longer than it should have, and actually was pregnant with my last child when I really kind of realized that it had been going on. And so once he was born in here, then I went and got the screening done, but I had stage 3A colon cancer.
Wow.
Which it is unfortunately becoming, while it's decreasing because of good screening in people over 50, it's actually increasing in those that are less than 50. Probably 1996, it was around 6%, and now it's up to 11% in those of us that are less than 50. So, and most of those are in their 40s. So definitely for people in their 40s, if they have any sorts of symptoms, very important to get
Are there
done.
particular causes? Diet, I would assume, hereditary.
There are, we know that family history does still play a role, even though it's not a must. But if you do have somebody in your family that's had colon cancer, so that's one of the things, is know your family history. If you do have somebody in the family, you need to get screened 10 years before they got diagnosed. If, you can the best thing to do is maintain a healthy diet and a healthy weight. Being overweight does increase your risk. And staying active. Those are the big risk factors that we know of. Too much red meat, decreasing that, more fruits and vegetables, more plant-based diet. All those things we know we should do.
Yeah, we're supposed to do.
But I will say that there are still, those are the things you can alter, but there are a lot of things that we probably can't alter, that things that are in the environment or in our family history. And so just listening to your body and paying attention so you can get it caught early, because if you can still catch it when it's a polyp, they can remove that polyp and you're good.
Right.
But if it's already invaded, then it can be.
Does it start
more
off
of
in
a-
the polyp? Is
it
that what that?
starts off
I
in
didn't
the
know that.
polyp.
Okay.
And so for people who have
Polyps.
polyps, they get colonoscopies more frequently,
Okay.
so they can remove those polyps more often.
Okay.
Right now, the recommendation is to start at 50 and get them every 10 years if they're completely normal. The other things, and I think a lot of women or people in general, that's a really touchy subject. Nobody wants to talk about a colonoscopy or have that done. So there are other things. You can just get a fecal blood test every
Right.
year, but you do have to get it every year. You can do a flex
Is it just as
sigmoidoscopy.
accurate
It's
as
not
a
quite
colonoscopy,
as
or-
good,
Okay.
but it's actually fairly close as
Okay.
long as you do it every year.
Okay.
So that is an option. And it's not for high-risk individuals. So somebody who's had polyps or cancer before, they couldn't use that. But for somebody who's low risk and really just wants to avoid that invasive colonoscopy,
They could do
they
that.
could do that. Now, if they get a positive, they're going to need a colonoscopy. But
Right.
if that's an option, that it would be better than them not doing anything.
Okay.
And that's what they're really trying to drive home, and what we want people to know is it's better than doing nothing.
Nothing. Okay. Thank you so much for visiting with us today. We appreciate it. Appreciate the
You're very
information. Thanks.
I'm glad to get it out there.